Hello and welcome to Arirang TV's continuing coverage of COVID-19. I'm Min San-hee. We are starting our program exactly a minute early today to bring you first a special public address by the heads of the Justice Ministry, the Interior and Safety Ministry and the Korea Communications Commission. The address comes amid ongoing government efforts to address the sudden surge in infections here in the country in recent days. Now, Justice Minister Chu Mi-ae, Interior and Safety Minister Chen Young and the Korea Communications Commission's Chairman Kim Sang-hyuk are poised to deliver their speeches. We'll come back to you afterwards.
First of all, here is Minister of Justice Chu Mi-ae. Honorable citizens, I am the Minister of Justice. Throughout the past several months, thanks to active cooperation by the public and dedication put forth by medical practitioners and quarantine authorities, the COVID-19 situation has been managed stably. And we were also praised as a global exemplar in terms of quarantine. However, lately, due to irresponsible actions taken by a certain group of people, the COVID-19 cases are surging at an unbelievable pace, and we are at the verge of a large second possible wave. This is putting at risk the safety and the lives of the public, and many of business establishments are forced to close down, and children cannot go back to school. Likewise, such losses are continuing, making it very difficult for us to maintain our normal daily lives. And this also leads to worries and even fears that everything that we've achieved so far could be in vain. Even under such grave situation, we are frequently witnessing people hindering the quarantine efforts put forth by the authorities, with some even nullifying the country's quarantine scheme. Such actions infringe on the public's rights to life and are deemed as grave crimes that put the country's existence at stake. To this end, the Ministry of Justice will abide by the Infectious Disease Prevention Act and other related laws to take stern actions against behaviors that violate the order of banning gatherings, rejecting, evading, and hindering epidemiological investigation by submitting false information, and so forth, as well as taking violent actions against quarantine officials like spitting, intentionally turning off their phones and escaping, refusing to get tested on a group level, as well as other acts of agitation. They will be subject to free investigation, compulsory investigation as well. In particular, and we will also, for the behaviors that hinder quarantine efforts maliciously, will be dealt with the principle of arrest investigation and demanded as the highest level of penalty. Due to the latest intensified quarantine measures, many of our daily lives, including religious activities, are being restricted. The government understands fully that this has caused great challenges to the members of the public. This challenge shall be overcome by mustering our energy. We need to stem further transmissions. If we failed to contain the COVID-19 outbreak now, we cannot overcome the consequent economic crisis. We ask the members of the public to have trust in the government and quarantine authorities and actively participate in the government's quarantine measures. I sincerely hope we can have trust in the power of the Republic of Korea and overcome this moment of crisis. Thank you very much. Next, we have Minister of the Interior and Safety, Jin Young. Good afternoon. I am Minister of Interior and Safety. We are encountering a crisis now. We need to muster our strength and energy to overcome such a difficulty. Nevertheless, if all kinds of illegal gatherings and breaches against quarantine measures continue, the consequent damages and losses will be inflicted on a majority of innocent citizens who are complying with the quarantine measures. I ask the police to take stern response against all illegal actions that can cause the spread of COVID-19. I urge you to take swift executions of power based on legislations and principles to protect the lives and safety of our citizens. The close-knit national quarantine scheme and curbing the spread of local transmissions highlight the importance of the role of the local autonomies. I ask the local authorities to boldly take responsibilities in accordance to the Act on Infectious Disease Prevention. All of the measures needed to curb the further spread, including isolating suspected patients and securing necessary information for epidemiological investigation, must be carried out swiftly. Honorable citizens, the government is currently exerting our full efforts for COVID-19 quarantine, and at the same time, it will also take stern actions against all illegal behaviors with the principle of zero tolerance. I ask the members of the public to show a high level of civil awareness. I ask for your continued cooperation for the quarantine guidelines put forth by the central and local governments. Thank you very much. Last but not least, we have the chairman of the Korea Communications Commission. Good afternoon. I am the chairman of the Korea Communications Commission. Successful quarantine calls for the public's trust in the country's quarantine measures. When false manipulation of information hinders the delivery of accurate quarantine information, especially that the government is manipulating the results of the diagnostic testings for certain church members, and likewise, these actions hinders our government's quarantine efforts. And due to the false manipulation of information, this will lead to increased confusion and nervousness, making holes to our quarantine scheme, which in the end will lead to damages and losses being inflicted on the public. To this end, the act of manipulating false information, or so-called distributing fake news, is an act that downgrades public trust in the national quarantine scheme. It is also deemed a grave social crime that threatens the lives and safety of the public. Fake news related to COVID-19 will be swiftly rooted out by intensifying our track and management scheme. Moreover, the government will make sure that its credible quarantine information and fact-checked reports will be made accessible easily and fast through our broadcasting and communications services. The act of not only making fake news, but also the act of distributing and spreading them will also be subject to severe consequences. I ask the members of the public to not be blinded or nervous by fake news and report immediately to related institutions. Thank you very much.
Right, and that was a special public address by the government on this Friday in which officials have vowed zero tolerance against those who violate prevention measures and of stringent legal consequences for those who endanger public health. We now turn to our Kwon Soa for more on the latest figures on the pandemic here and abroad. Soa, how are we ending this Friday?
Well, Sunny, we're seeing the highest figure we've seen since early March when it comes to daily cases. Let's just get straight into the details here. We have 324 new cases, with 315 being local infections. The death toll stands at 309 with 2 additional deaths, and the number of people in quarantine at 265, and we have some 57 new recoveries. Now, it was last Friday when daily cases started to surge to the triple digits, and now we see that this figure has actually tripled over the past week. And if we go over to our map, the wider capital region has reported almost 250 cases this Friday, with the majority of those linked to the Sarang Church in northern Seoul. Meanwhile, the country reported 9 imported cases, which means these cases have declined to the single digit. But that does not mean that the global figures have declined too. In fact, the top three here are now accounting for over 12 million cases, reporting tens of thousands of new daily infections. And if we go over to our next table, Spain has surpassed 404,000 cases as this country is seeing a resurgence in cases, having the highest daily figure in the past 24 hours, now surpassing Chile. And Iran, meanwhile, has surpassed 20,000 fatalities. And last but not least, the global figure in total stands at 22.86 million with over 797,000 fatalities. And those are the figures I have for now, but I'll be right back with more updates after the government briefing. Sunny?
Right, so thank you for that. I'll see you back at the desk. It's time now for the regular afternoon briefing on COVID-19. Do remember this weekend that the number of people who can participate in rallies here in Seoul has been limited to 10 until the end of this month, which means that although we are facing prevention protocols under level 2 of social distancing measures, with regard to rallies, the government that is asking people to limit that number to 10. On the screen, we have the social distancing guidelines for level 2. Maximum of 50 people are allowed for indoor gatherings, while for outdoor gatherings, you have to keep that limit to 100 people. No spectators are allowed at sports venues, stadiums, so fans of football and baseball may not watch their games at the stadiums anymore, while high-risk facilities, which include a group of 12, including buffet restaurants, clubs, cram schools that have more than 300 students, cannot have their businesses operating until the government lowers the level to 1. Also, schools are being asked to make an academic approach that includes a hybrid of both online and offline courses, with many calling for offline courses to be much more safer. We also have workers being encouraged, that is, to take teleworking instead of going to the office in person. Right, the briefing is about to start. We will come back to you afterwards.
First of all, here is Director Chung Eun-kyung with the explanation. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of August 21st, midnight, we have a total of 315 new local infections and 9 new imported cases. The total caseload now stands at 16,670. 57 more people have been discharged following full recovery, while a total of 2,241 people are in quarantine. There are 18 patients with severe or critical conditions. As of yesterday, we had 2 additional fatalities, with the death toll standing at 309. The fatality rate stands at 1.85%. I extend my deepest condolences to the deceased and the members of the bereaved family. Here are some updates on our domestic infections. Starting from the Sarangjeil Church in Seongbuk-gu District, Seoul City, we have found that 56 additional cases have been confirmed, and in total, we have a total of 732 people being confirmed. 686 of them are a cluster in the metropolitan area, including the city of Seoul and Gyeonggi-do Province, as well as Incheon, and 46 of them are clustered out throughout the non-metropolitan area. And we have 211, which are about 28% being over the age of 60, and also 97 cases who are over the age of 70. And as for this church cluster infection, we have identified 19 venues which have further transmissions, and a total of 100 have been infected. And currently, we have putting in place epidemiological investigation for 168 facilities to prevent further transmissions. And these facilities include 7 religious centers, 4 nursing hospitals, 2 health clinics, 5 office buildings, and 1 school. And in relation to Gold Train in Gangnam-gu District, Seoul City, and in relation to the Yangpyeong group meeting, we have 12 more cases and a total of 88 being confirmed to date. And related to the August 15th Gwanghwamun rally in Seoul, we have confirmed 53 more cases, and in total we have 71 cases being reported, and 67 are related to the rally, and 4 were the police members who were dispatched to the scene. And epidemiological investigation shows that there are no direct relations for the Sarangjeil Church, and we are also conducting our further investigation. And regarding with the athletic college preparatory classes in Seongbuk-gu District, Seoul City, we have 10 additional cases with 28 in total. And in relation to the Yeouido Full Gospel Church, we have 13 more cases being confirmed, and a total of 20 have been confirmed to date. And we are also carrying out epidemiological investigation. And in relation to a theater in the Seongbuk-gu District, we have the first case identified, and we have 16 additional cases, and in total we have 17 cases, and the sources of infection and the epidemiological investigation is currently underway. In Gangchon-gu District and Gangdong-gu District in Gangchon, we also have the Purugio Daycare Center, and we have a total of 15 cases being confirmed to date. And in relation to the Urijail Church in Yongin City, we have 9 more cases, and in total we have a total of 174. And in a church in the Incheon Namdong-gu District, we also have additional cases of 16, and a total of 17 cases have been confirmed to date at this specific church. And in Cheonan City, we have the Cheonan Dongsang Church. We have 3 additional cases, and a total of 8 people have been confirmed. And in relation to a sports facility in Gwangju City, we also have found that 9 additional cases have been confirmed, and in total we have 10 cases to date. And we have a total of 9 imported cases, 3 of them being confirmed at the points of entry, while the rest of the 6 have been reported while on self-quarantine. 5 were South Korean nationals, with 4 being foreigners. As for the countries, 3 were from the Philippines, 2 from Kazakhstan, and 3 from the U.S. The KCDC notes that we have seen a large cluster infection spreading stemming from the Sarangjeil Church and the Gwanghwamun rally on Liberation Day, as well as heightened foot traffic for the summer holidays, and we are concerned of possible outbreak. And today in the metropolitan area alone, we have 244 cases, which account to about 82% of the entire total cases that have been occurred today. And aside from Jeju Island, we have infections being reported at all of our 16 provinces and cities nationwide, and thus we are very worried about the possible nationwide outbreak. During this weekend, we ask you to postpone and cancel your gatherings and your plans to travel as well. The KCDC also notes that at a situation where we are seeing increased risks of nationwide cluster infections, we ask all of the residents in other non-metropolitan provinces to also abide by level 2 measures. And we ask you to refrain from making non-essential outings, except from commuting to work and going to the health clinics. Instead of eating outside, we ask you to utilize the delivery services as well as takeouts, and please also work out from home instead of going to sport gyms, and also switch your gatherings to online means. And even when you go outside, please wear your face mask indoors, and please wear your masks even at outdoors when 2-meter distance is not maintained. And also maintain physical distance with others, and please minimize any physical contact like handshaking with others, and please refrain from going to close, crowded, and close contact environment. And if you feel sick, like if you have symptoms like a fever or respiratory symptoms, please do not go outside or go to work and get tested as soon as possible. During the weekend, we also are highly concerned of a possible outbreak at churches, and we also ask all of the churches to abide by the quarantine measures, to have online services only. And as for the metropolitan cities and other churches in these areas, we ask you to abide by the administrative order that bans all of the church-hosted in-person events, gatherings, and group meals. And we also ask the churches in the other, aside from the capital area, to also switch to online means and also refrain from gathering and eating together.
The
COVID-19 is spreading at a very fast pace, and today our daily cases exceeded 300, and new cases were reported at all of the cities and provinces nationwide except for Jeju Island. The Sarangjeil Church cluster infection has been spread through the means of Gwangamun rally as well as the summer holidays, and we are very much worried about the situation. The trends of the outbreak are spreading very fast among the daily routine venues like restaurants, cafes, and snack bars, and this is also spreading to those high-risk facilities like the nursing hospitals and the daycare center that are prone to the infections. And if you are living at the metropolitan area, you can be exposed to the virus at any time, at any place. The government has also managed and curbed the further outbreak. However, we believe that there are restrictions and limitations to curb the further spread of the virus just with our own unilateral efforts. Unless we cut all of the physical distances and physical contacts, we believe that we will also be faced with similar damages that are witnessed in other parts of the world, including Europe and the US. And we ask you to continuously take part in our quarantine measures to overcome the current crisis. The next 2 weeks is a moment for you to minimize your physical contact, and please refrain from making outings, non-essential outings, that is, and also cancel all of the group gatherings with your relatives, with your colleagues, and so forth. And all of the meetings and worship services should also be switched to online means. And refrain from dining together at indoor places without your face masks on. And when you are indoors, please wear your face masks properly. When you are at restaurants, cafes, or bars, please minimize the time of taking off your mask. We need to have a concerted effort in participating our quarantine measures, including wearing a face mask and distancing measures. And we believe that this is the only way to overcome the virus spreading further. And we ask you to stay home, safe and sound during the weekend. We will also exert our full efforts. Thank you very much.
문자로 보내주신 질문에 대해서 답변드리도록 하겠습니다.
Right, that was Chung Eun-kyung, the head of KCDC, with Friday's afternoon briefing. Suah, do give us a summary of that briefing.
Sure. Well, let's start off with the hotspot of the coronavirus here in Korea, the Seoul Sarangjeil Church in northern Seoul, as 56 more cases were reported there, bringing the total to 732. And 686 of those cases occurred in the metropolitan region, but also 46 in many other places across the country. In fact, this Friday, we're seeing that all cities and provinces except for Jeju Island have been affected by the virus. And this is also why Chung Eun-kyung, the KCDC chief, mentioned that this weekend people should try to postpone or cancel any meetings, gatherings, or events, and also abide by the social distancing measures, which are at level 2 here in the capital region. But also anyone else across the country should try to follow these measures because the virus is spreading across the country. Currently, we have more than 80% in the metropolitan region, but as I said, there are chain transmissions happening across the country.
All right, so thank you for that. We'll see you again on Monday.
See you on Monday.
Right, staying on the local front, the spread of the virus this time around appears to be more extensive, affecting operations at City Hall, large firms and even broadcasting stations. I have Oh Jong-hee with me now for more on this grim reality. Welcome, Jong-hee.
Good afternoon.
Right, now, Jong-hee, I didn't mention it, but the latest outbreak is also affecting the academic arena. I hear Korea's education minister held a virtual meeting earlier this week, that is, with relevant officials nationwide to discuss the severity of the situation. Tell us more.
Tony, the government sees the current outbreak situation in the country as very grave and is therefore very worried about the large number of students returning to schools for the fall semester. Now, the key is to limit the number of students allowed on the school grounds at any one time. The government has already advised schools in the Seoul metropolitan area to limit the number of students to a third or two-thirds of their attendance capacity until September 11th. It also called on schools in other areas to follow suit. Take a listen to what Korea's education minister and Deputy Prime Minister Yoon-hye had to say on Wednesday.
During a one-week period from August 11th through August 17th, 65 students and 9 teaching staff tested positive. 77% were in Seoul and Gyeonggi-do province. We once again request schools in regions other than the Greater Seoul area to prioritize student safety and reduce the density to two-thirds or less.
Private academies with over 300 students are regarded as high-risk facilities and are therefore banned from opening until the end of this month.
I see. Jong-hee, I hear that universities in Seoul are also having second thoughts about resuming in-person lectures this fall.
That is right. They actually wish to proceed with a combination of both online and in-person classes, depending on the number of students enrolled in each course. But with another major outbreak threatening the Seoul capital region, Yonsei University is holding all classes online until the end of October, Seogang University until the end of September, and Hankuk University of Foreign Studies until mid-September.
Right. Now, like I mentioned earlier, Jong-hee, the latest outbreak, it's forcing shutdowns at major broadcasting stations and even Seoul City Hall.
4 broadcasters in Seoul have reported new cases of COVID-19, and Christian Broadcasting System, or CBS, had to shut down its building from Wednesday to Thursday as one of its reporters tested positive for the virus. Now, SBS, or Seoul Broadcasting System, is on high alert as a worker at a daycare center inside one of its buildings in Western Seoul was confirmed to have COVID-19. It's shutting down the building on Thursday and Friday. The main building of Seoul City Hall had to be closed on Wednesday for disinfection after a civil servant tested positive there. COVID-19 cases have also been reported at major South Korean firms, so the companies are allowing their workers to either work from home or apply flexible working hours.
Now, the latest outbreak, which started at a church in northern Seoul, has now spread, I hear, to many different parts of the nation. Do give us the updates.
Right. According to the government briefing this morning, a total of 739 cases have come from the Sarang Jail Church. Now, cases related to that church have spread to 12 cities or provinces nationwide, despite it having affected the Seoul metropolitan area mainly. So this means that this outbreak is now evolving into a nationwide outbreak. When considering the possibility of secondary infections, over 110 locations are set to be at risk, plus large demonstrations in central Seoul over the Liberation Day weekend may have added more fuel to the latest outbreak as people gather from all across the country by bus.
Jong-hee, I understand some observers believe that the government is also partly responsible for public complacency with regard to prevention measures. Please explain.
Right. Some medical experts actually say that the government's disease prevention measures have been lax since late July because the authorities have been allowing small-scale gatherings at churches and spectators at sporting events. Plus, the government's efforts to boost domestic consumption, for example, distributing coupons for restaurants and performing art venues, gave the wrong signal and led to complacency. Seoul has raised the social distancing alert level to stage 2, but some pundits are skeptical and claim that it has to be raised further to level 3. The government is wary that the current outbreak in the capital region could develop into a nationwide crisis, but is cautious about raising its social distancing level as it could deal another significant blow to the economy.
All right, Changyi, as always, thank you for that report and do stay safe.
My pleasure. Thank you.
Right, social distancing guidelines in the metropolitan area have been toughened, and city officials in Seoul are going the extra mile to prevent an outbreak on public transportation, including that underground. For more on these efforts, our Chun Song-cho is at one such subway station. Hello, Song-cho.
Good afternoon, Sunny.
So I hear you are at Gyeongbokgung Station in central Seoul, Song-cho.
Yes, I'm at Gyeongbokgung Station, line number 3, and as the name suggests, the station is located right in front of Gyeongbokgung Palace, the main royal palace of the Joseon dynasty. Well, and it's in the heart of central Seoul with many other neighboring landmarks such as the City Hall, Gwanghwamun Plaza, the presidential office of Cheongwade. So you can imagine the area is always bustling with tourists, locals alike, with many of them using the subway station and the subway system for traveling. And also the thing is, the neighborhood has also become an area of focus for protesters recently. Just last weekend, in fact, thousands of people gathered in the neighborhood for a huge anti-government rally. And when the news broke out that some of those protesters tested positive for COVID-19 after attending the rally, the government sprang into action immediately to curb the further spread of COVID-19. And one of the first things that the government did was disinfecting all the subway stations in the vicinity, including Gyeongbokgung Station, for 4 straight days. So here, Gyeongbokgung Station, I can see the local authorities have really ramped up its cleaning procedures, disinfecting all the frequent touch points, such as turnstiles, handrails, handles, buttons, anything that people frequently touch. And they're doing it at least 4 times a day. And you can also see hand sanitizers put in place in every corner of the station so that people can clean their hands as frequently as possible. Now, of course, all of these measures are for nothing if riders don't follow public health guidelines on an individual level. And I want to stress enough, I cannot stress enough, the importance of everyone practicing hand hygiene as strictly as possible. And also to mind you, subway is underground, right? So that means it can have limited ventilation. So you have to protect yourself and others by keeping the facial mask on at all times in a proper manner. So just don't wear the mask. You have to band the nose wire around the nose bridge to make sure that you have that snug fit, and the mask is fitted to your face as tightly as possible. And if you see anybody who's not wearing the mask properly or not wearing one, then you can use the mobile application called Gov'T Urban Railway, or just call the Seoul Metro Service Center. And before you get on the subway, what you can do is go on the official website of Seoul Metro, and you can see how busy the subway that you're going to take. And see how you can plan your commute around all the information that's provided on the website, and make sure that you don't come into close contact with too many people while using the subway. And of course, you cannot let your guard down while you're inside the car, right? So I want to give you some golden rules of train etiquette for you. So once you're inside, you have to make sure you keep social distance with other people, from other people at all times, even when you're standing or sitting. So let's say you want to take a seat. Then you want to leave at least a bit of space between you and the others. So let's say 1 or 2 empty seats in between. And also talking on the phone or having a conversation with people around you is something that's really frowned upon these days as well amid the pandemic. Now, according to government data, around 7.3 million people use subway on a daily basis. That's a lot of people. But luckily, we haven't had any major infections transmitted by local subway riders. But let's not forget that the social distancing level has been strengthened by the government recently and raised to level 2. So let's always be cautious and careful when using public spaces and facility, because that's the only way we can move forward while keeping the virus at bay. This has been Jeon Sung-cho reporting live from Gyeongbokgung Station in Seoul, and back to you, Sunny, in the studio.
Indeed, Song-cho's safety is priority amid the pandemic. Thank you for that coverage.
저희 방역당국의 검사 결과는 조작이 불가능하고 누군가를 차별할 수 없다는 점을 다시 한번 분명히 말씀드립니다. 잘못된 정보를 생산하거나 확산하는 일을 중단해 주시고 저희 방역당국의 조치에 적극 협조해 주시기 바랍니다.
Spreading as fast as the virus is fake news about COVID-19 that is threatening efforts to contain the new outbreak. For more on this disturbing scenario, I have Dr. Yu Byung-uk from Suncheonyang University Hospital. Good to see you again, Dr. Yu. And I also have Professor Tak Sang-woo from Seoul National University. Welcome back, Professor Tak.
Hello.
Professor Yu, let's start with the reality that back last Friday, we ended the work week then with 103 cases. This Friday, we are ending the week with 324 cases. How do you assess the current situation? Do you believe, can it be, that is, be brought under control?
Well, I never see the two minister and the chief of CDC announce the same time. So we see the 30 minutes before, which means it's kind of abort of the crisis, like the balloon. It look like the burst out, but seems okay. But now our situation is ballooning, put under pressure, but not burst out before, but will be soon. Why? Because my thesis is earlier this week, around 100, 200 something the patient. It came from the end of July and early August. It's a monsoon season and the vacation season of Korea. So that time we forgot to, and we not keep about social distancing and properly wear a mask something, because we thought Corona is gone. That's why it's coming. But unfortunately, someone who didn't listen about the advice, so who are gathering and they are concentrated end of last week. So that case is coming now. It's a mixer, which means until yesterday, the nearly 300. From today, it's more than 300. Probably all the weekend, more than 300, 400, 500 can become. And my little concern is from the next week, or next week, if we have more than 400, 500, we'll be out of control situation.
I see. So you have a rather dismal outlook then. Professor Tak, quite a number of people who took part in the Liberation Day rally this past Saturday in Gyeongbokgung and Gwanghwamun streets tested positive. What's really daunting is that to test more patients, you need to have a list, so to speak, of the participants. But this list does not exist. How can the government overcome this particular challenge?
Well, they will get the list anyway, but the problem is we don't have enough number of contact tracers. We need more contact tracers. When there was an active outbreak going on in May in United Kingdom, the Prime Minister, Boris Johnson, announced that they will hire up to 25,000 contact tracers. And contact tracers to trace back all the potential contacts and exposed so they can minimize and quarantine those who might be infectious. And I think that's one of the solutions we need to think about right now.
I see, getting a greater workforce to do the contact tracing.
Exactly. Right.
Dr. Yu, there have been bizarre conspiracy theories, including one about health officials manipulating test results. Is such manipulation possible?
Controversy theories only possible in movie, not in real world. Because I'm working in the screening centers and also our patients. I do attend, I'm served for my patient sincerely on my heart. It cannot be possible, impossible, because every single patient who wanted tested, not only one hospital, not only a single center, the multi-centers, and they did test and they did report it, and the many people are handling and connecting the data and finally send to the government. So if we can be, who thought it manipulated and be handled, more than 10,000 people keep lying about it, that time we can be deceived about it. So controversy theory is only possible in the movie, not in the real world.
I see. Professor Tak, there's also talk about authorities refusing to lift quarantine protocols on those who came into contact with infected people but tested negative. Could you explain this for us a little bit?
Well, rule of thumb is that if you are in the same boundary with the confirmed case, but had enough space, in physical space, wearing a mask properly, you're considered as a casual contact. On the contrary, if you're in the same boundary but made a close contact, did not wear a mask properly, you're considered as a close contact. If you're close contact, you should quarantine yourself at least for 2 weeks, regardless of the result of the testing. So even if your test result is negative, that doesn't mean that you're not infectious. You may be still in the incubation period. You may end up infecting other people. So after 2 weeks of quarantine, home quarantine, you are tested, repeated test, and then show negative, and you can be released.
So it's better to be safe than sorry then?
Oh, yes.
Dr. Yu, is fake news undermining the public's willingness to cooperate with the government? And as a doctor yourself, what are some of the more dangerous types of misinformation that is disseminating about COVID-19?
Well, it's alcohol. But alcohol for the methanol is alcohol for using for the industrial area. But some people believe that mixed with the methanol, alcohol with the water, gargling themselves, all the viruses will kill and you are saved. But actually that behavior can themselves, because methanol alcohol can damage their liver and some. Other one, like wear mask is useless, and the God take care of you yourself, so mask is not necessary. This is kind of fake news. Other one is hospital give the wrong information because even the patient are negative, but they give the selectively get the positive of the COVID-19. That's why it is all lying from the government manipulation. Already we mentioned about it, but there are many things. But there are scientific basis to we are answering. So the Korean government side or WHO side, the news at EpiWin, we provide the right answer and the fake news. If you want to double check, you can check the website of the Korean government provided the right answer about it, and also WHO EpiWin, they will provide the right answer. Don't receive the fake news.
I see. Professor Tak, as Doctor, you just mentioned, we have talk about miraculous cures using alcohol and mind-boggling conspiracies about the government manipulating test results. What can members of the public do to ensure that they're accurately informed?
Well, I think citizens will have to rely on the major news media information sources. If any of those credible information sources available in handy, I think the KCDC website is probably the best shot. And relying on those credible information is very critical. But more importantly, the responding agency needs to do due diligence by identifying those misleading information and distorting news media and channels, and probably counterattack and to prevent the public from being misled. So that kind of effort should be done systematically.
Right. Dr. Yu, what appears to be as alarming as the infection itself, perhaps, is the information about the side effects of COVID-19 well after recovery. Could you tell us a bit more about that? I understand that extensive research needs to be done.
So many experts have the different ideas, because some experts say it's COVID-19, it doesn't affect the side effects, but do believe that we have some evidence. For one example, the one professor who lives in Busan, he is still complain about how to say in simply brain fog. Brain fog means who walking in the fog, cannot be concentrated well. Medically we say clouding consciousness, which means we cannot concentrate well and we couldn't remember well, and always dull and dizzy in the mind. But this can be possible because COVID-19 virus is a very new virus, can produce inflammatory matter that is on the left in your body and in the blood can be circulated all the part of your body, especially brain and kidney and liver and the main organ can be left damaged. It's like the diabetes. So the people with a diabetes who have more chance of stroke, and the stroke can make this kind of the full lifelong the sequelae and the complication. It can happen. One sample will happen. I'm sorry about it. Young man who got the cytokine storm, and finally he's gone to the heaven. But he never had any other condition like a diabetes, high blood pressure, which means we don't know what happened exactly because COVID-19 virus is very new. Complication can be happen later. One of very funny, but it's not funny one. 1960, some medical journal and medical research they said smoking no harm for your health. No harm. No, doesn't make cancer. It was real medical articles in 1960, but now no one believed about it, which means some people said, some experts said COVID-19 can be fine for the young people, but this moment no one can tell about it. So we have to, so the Jung Eun-kyung chief of the Korean CDC said anyone can catch coronavirus now, and no one knows what happened later in the future. So we should be prepared of the prevent it against the COVID-19. This is a message from the professor in Busan.
I see. So the wise words again, prevention is better than cure then.
Yep.
Professor Tak, there are also concerns that hospital beds in Seoul may not be able to accommodate a surge in the number of patients because already 80% of them have been filled. I also understand that the capacity needs to hover at around 70% for medical staff to believe that they have things under control. What are your thoughts on this?
Well, to be honest with you, I'm actually concerned that we're approaching to the point where we see a significant deficit in the available beds and intensive care units. And this is what we are really concerned about. And when that happens, we'll see an acute surge in the demand on medical countermeasures and medical resources for those COVID-19 patients, and especially those who have underlying conditions, who are elderly, and they are of critical interest for us because they will be the most vulnerable population we need to protect. And we need to have available beds and ICU units. And to be able to prepare better, I think we should start seeing more concrete plans on which hospitals will have available beds, which hospitals will send their patients to where. And this kind of concrete plans is what we need.
Right. All right, Professor Tak, as always, thank you for your thoughts. And Dr. Yu, thank you for being with us today. Right, that brings us to the end of this week's coverage of COVID-19. Health authorities have highlighted the importance of social distancing this weekend to contain the latest spread of the virus. Do partake in the public good to protect your health as well as that of those around you. Thank you for watching. See you next Monday.